Hello and welcome to our podcast. We are Group 1 and today's topic is TB and HIV, double trouble. Now we're going to go over HIV infection basics. HIV stands for Human Immunodeficiency Virus. AIDS stands for Acquired Immunodeficiency Syndrome. The reason why once you get HIV, you have it for life is because the human body cannot get rid of HIV completely, even with treatment. There's currently no effective cure, however, it can be controlled. The ART helps prolong life, keep people who have HIV healthy, and lower their chance of infecting others. The three stages of HIV are acute HIV infection stage, clinical latency stage, and AIDS. Now to go over some TB infection basics. TB, standing for tuberculosis, is caused by a bacterium called Mycobacterium tuberculosis. It is spread by air, so if someone is infected, they can spread it then by coughing or talking. However, it is not spread by shaking someone's hand or sharing a food or drink, touching fed linens or toilet seats, even sharing toothbrushes or kissing. When a person breathes in the TB bacteria, the bacteria can settle in the lungs and begin to grow. From there, they can move through the blood to other parts of the body, such as the kidneys, spine, and brain. It mainly affects the lungs, even though it can affect other parts of the body. And some signs and symptoms of a tuberculosis infection can be weakness, weight loss, fever, bad cough that lasts for 3 weeks or longer, chest pain, and coughing up blood or sputum. And there's also two different phases of TB. There's latent TB, and there's just the TB disease. The TB disease is the active and it grows in the body. And the latent TB, it lives, but it's not growing. It's just dormant. If you have HIV, it is important to know you have a TB infection because HIV weakens the immune system. When a person's immune system is weak, latent TB infection, which as we spoke in the earlier slide, it lives in the body but it's not growing, can now quickly progress to the TB disease, which now means will be active. If you have HIV, it is very important to get a TB test as well. Thankfully, there is testing available, and the only way to know if you have HIV is to get tested. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of a routine health care. For more information about this, you can also visit cdc.gov and look under HIV basics and testing. If you have a rapid HIV test performed and the result is reactive, it means that the test indicates that HIV antibodies were found in your blood or oral fluid sample. Anyone whose result is reactive to the rapid HIV test must have a second or confirmatory test done. This is the more accurate test and is done to confirm or check the results of a rapid test. It takes longer to get the results of the second test, sometimes as long as 2 weeks. If you have not yet had the second test, ask your doctor for a list of places that offer confirmatory testing. There are 3 types of tests available that are confirmatory: nucleic acid test, the NAT, antigen antibody test, and the regular antibody test. HIV tests are typically performed on blood or oral fluid. And if you test HIV positive, it doesn't mean you have AIDS. AIDS is the most advanced stage of HIV disease. As we showed before, there's 3 stages. HIV can lead to AIDS if a person doesn't get treatment or take care of their health. They also have the option to be anonymous or confidential when they get the test done. So if you take an anonymous test, no one will know the result. And if you take a confidential test, your test result will be part of your medical record, but is still protected by state and federal privacy laws. There are treatment options for HIV, and there's 5 classes of HIV drugs as shown here. HIV medicine is called an ART, otherwise known as an antiretroviral therapy. Again, there's no cure, but an ART therapy can slow the progression of the disease and is recommended to combine 3 drugs from 2 different classes to avoid drug resistance. There are 5 different medication classes available for slowing the progression of HIV. These include non-nucleoside reverse transcriptase inhibitors, NNRTIs, nucleoside or nucleotide reverse transcriptase inhibitors, NRTIs, and protease inhibitors, entry or fusion inhibitors, and integrase inhibitors. Now, when treating the TB disease, tuberculosis, and HIV, there are several ways of doing this. When it's caused by known organisms of the disease, the treatment regimen consists of a 6-month daily dosing of the following. The first 2 months of an intensive phase of the pyrazinamide, rifamycin, isoniazid, and ethambutol. And then following 4 months would be a continuation phase of PF, rifamycin, and isoniazid. For more information, you can visit cdc.gov/TB and look under topics and treatment. For the antiretroviral therapy during tuberculosis treatment, for better health outcomes, it's recommended that the antiretroviral therapy be initiated during the duration of treatment for tuberculosis instead of at the end of treatment. During the first 2 weeks of initiating tuberculosis treatment, antiretroviral therapy should be given to patients with CD4 cell counts below 50, and during weeks 8 to 12 of TB treatments to patients with CD4 cell counts greater than or equal to 50. HIV-infected individuals are the only exception. It is recommended for these patients with TB meningitis not to start antiretroviral drug therapy until after the first 8 weeks of treatment for TB. There is also a fact sheet available for patients. You can visit cdc.gov/TB/publications, and you'll see there a listing for fact sheets regarding the tuberculosis disease. Like mentioned before, there are several ways of treating tuberculosis when the patient has HIV as well. And before we've discussed tuberculosis is caused by a bacteria spread by the air. And TB usually affects the lungs, but TB-causing bacteria can attack any part of the body, including the kidneys, spine, or brain. And if not treated, TB can cause death. HIV weakens the immune system and increases the risk of TB in people with HIV. So people who have both HIV and TB should be treated for both diseases. And the choice of medicines to treat HIV and TB co-infections depend on the person's individual circumstances. A question may arise though, when should you start antiretroviral therapy? Well, the ART is usually a use of an HIV medication to treat HIV infection, and it's recommended for everyone who has HIV. It's still case by case, as we mentioned before, but ARTs help people with HIV live longer and healthier lives. People with HIV should start an ART as soon as possible, as mentioned before, and in people with HIV who have the following conditions, it is especially important to start an ART right away. So, if you're pregnant, you have the latent third stage of HIV, so AIDS, certain HIV-related illnesses and co-infections, and a recent HIV infection. So recent HIV infections is a period up to 6 months after the HIV infection. Before starting ART, people with HIV should discuss the benefits and risks of the ART with their healthcare providers, and also discuss the importance of medication adherence, taking HIV medicines every day and exactly as prescribed. For more information on this, you can visit the U.S. Department of Health and Human Services, otherwise known as HHS, under AIDS Info. And there's also more information can be found on the Mayo Clinic website as well. When looking for support and resources, it's always good to know where you're getting your answers from. And it's good to know that the cdc.gov and the nccc.ucfs.edu and other colleges alike have a wide variety of information available regarding tuberculosis and HIV. And there's also now, with our growing technology, uses for apps. So there's the Answers app. Its HIV Answers application, Living with HIV, can lead to unanswered questions that many patients may not feel comfortable asking their doctors. So with the HIV Answers application, these questions can be answered in the privacy of your own home. Some features include steps to treatment, get answers, talk to your doctor, and keep track. All of these are resources to provide support for patients living with HIV. Another cool app out there is called the Life with HIV Daily Charge. Much like HIV Answers, Daily Charge provides patients the opportunity to take control of their disease and gain stability in an otherwise challenging diagnosis. Equipped with features such as Learn, Progress, patients can earn points, which earns the opportunity to donate to a charity of their choosing. And Support Daily Charge puts HIV management in the forefront of the patient's daily routine. Hey, doesn't that look familiar? CVS also has an app called CVS Specialty. Amongst others that are available out there with other retailers, CVS Specialty Pharmacy markets themselves to offer comprehensive medications and services to treat rare and complex conditions. So many pharmacy companies offer such services, and the CVS Specialty app is an example of how medication management can be done digitally. In summary of today's podcast, going back over some of the basics and main key points of today's podcast would be that HIV is the virus that causes HIV infection. AIDS is the most advanced stage of the HIV infection. HIV is spread through contact with blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, or breast milk of a person with HIV. In the United States, HIV is spread mainly by having anal or vaginal sex or sharing drug injection equipment with a person who has HIV, or getting stuck by a needle, so that could put you at risk. Antiretroviral therapy, ART, is the use of HIV medications to treat HIV infection. People on ART take a combination of HIV medications. It's often called an HIV regimen, and they take this every day. ARTs can't cure the HIV infection, but it can help people with HIV live longer, healthier lives. HIV medications can also reduce the risk of transmission of HIV. And if you need to know if you have HIV and you've been put at risk, the only way to know is to get tested. And for more information on testing and even testing sites, visit cdc.gov. For this case, if you have HIV, tuberculosis is one of the most common co-infections that people living with HIV can develop. Testing for TB can easily be done with a blood test, or by taking a sample of mucus or other bodily fluid, or with a skin test. If you're diagnosed with active TB, you'll be offered a treatment with a course of antibiotics. And they'll adjust the HIV regimen when giving your treatment for the tuberculosis. Now, pulmonary TB is the only type of TB that can be passed on to others. And if someone with TB coughs or sneezes, the bacteria in these tiny droplets can be inhaled by another person. However, not everyone affected with TB will become ill. There are two types of TB infections, like we've said before, inactive and the dormant, latent TB. So if you are experiencing cough for more than 3 weeks, extreme tiredness, fever, night sweats, loss of appetite or weight loss, and symptoms of active extrapulmonary TB often include swollen glands or pain in the affected area, so you may want to get checked out and take one of the tests for TB, especially if you're immunocompromised. So more information, you can go to cdc.gov, tbfacts.org, also the WHO. The WHO has a lot of good information for global, when you're talking about all the countries, not just us. They have a large pool of information as well on TB and HIV. For more information regarding HIV and some of the fast fact sheets, you can look under HIV and TB on the CDC website, and they have a lot of good resources to help with looking for diagnosis information, different types of therapies, and even support centers. So thanks again for listening to our podcast today. I hope it's been informative.